I'm your friend, Dr. Charles Apoki. We lost an elder statesman, another one, in the person of Dr. Doyin Okukpe. He happened to have left the College of Medicine, University of Ibadan, where I schooled several years before I came in. I want to extend my heartfelt condolences to his family. I pray that God will strengthen them. Please, I'm not doing this video for political reasons, so don't come here and make stupid political comments. I want to speak to men and to the society. He battled with prostate cancer. I don't know if it is prostate cancer as stated in the news channels. He battled with issues of prostate, let me use that statement, for 16 years. That means he was 56 when the issue was diagnosed. And usually some scientists believe that it starts at 55. We don't know if the issues were there 1 year before. Usually, issues of prostate cancer runs in families. I know a family where several males have been affected. One of the lineage, the father died of that same issue. The point I want to make is that males in our society are not taken as endangered species. The average man having prostatic issues does not know most likely what is wrong with him. Many times, people are ashamed of telling people what is wrong with them because anything that involves the male genitalia and inability to pass urine, or you are passing urine frequently, or you have pain while passing urine, or there is blood while passing urine, the tendency is to associate it with promiscuity or venereal disease. That is not true. From the age of 50 upwards, or as your hair starts to gray, your prostate starts to enlarge. It starts to enlarge. And if care is not taken, it can obstruct the urinary tract and you find it difficult to urinate. You strain. When you urinate, the urine will be dribbling. You have to ring a bell with your bola so that it doesn't stain your trousers. As we get older, we experience that. Some of us are experiencing them. And so first thing is that we need to start educating people, males, about prostate issues. We must start early to educate men about prostate issues. Number two, there are preventive medications that men can start taking early to shrink the prostate. I'm talking of Western medicine. I did my PSA, which is the chemical you test for to know if your prostate is producing that chemical or your body is reacting to it beyond normal level. I did it about, I think 2 years back. it was at the upper limit of 4, which is 0 to 4, the upper limit. And I called my children overseas that I needed the medication to shrink the prostate. And they sent me 6 packs or thereabout. By the advent of this new administration, the thing we're buying for 12,000 naira has become 72,000 naira. But when I went, well, my son found out that it was still equivalent of 12,000 naira in his country where he resides, or the country where he resides. And he sent me those 6 packs. And I took the 6 packs for 6 months, or 5 packs, because I gave one to somebody who was having issues, judiciously. And yesterday, the result of my PSA came back. It has dropped to 2.6. That means the medication worked. And I was discussing with the health care practitioner if I could continue. He advised me that there was no need pumping chemicals into my body when the thing has shrunken. So I want to advocate that the wealthy in the society, wealthy men in the society, let's start a prostate health campaign or fund or foundation where if men have prostate issues, there are designated hospitals. Kano Wanko has a heart foundation. There are designated hospitals, at least in major state capitals, where they can go, be investigated, and be given preventive treatment if it is just benign, if it is not cancerous. And the federal government, through the Ministry of Health, should not only be talking about women issues, they should talk about men issues. Many men are dying because of the issues of prostatic cancer. And we can also, from that fund, arrange for competent doctors who will volunteer. We subsidize the surgery so that when it is benign, it can be removed easily. Even if it is pre-cancerous, that has not spread, it can be removed easily. And also, the medications that men will need for chemotherapy and the cost of radiotherapy can be brought down in such hospitals so that men can have easy access to good health care. You would think that 72 is very far. No, I'm 66. 6 years from now, I'll be 72, and I still feel very strong. I still have a lot of hope and a lot of things to do. The next thing I want to say is that those of us who have had the opportunity of being politicians, we must take the health sector of this country very, very seriously. The idea of the president running overseas for treatment, governors running overseas for treatment, rich men running overseas for treatment is not sustainable. I heard that Dr. Doyin Okukpe was taken to Israel and he subsequently came back, died during a surgery. I don't know how far it is alleged. But we must make sure that our health facilities are very, very functional. There is no reason why each state capital should not have a center for prostate issues. This is my submission. And I want to advise men, start early to start taking care of yourself, checking your PSA, checking anything that concerns your prostate. It will save you and your family and the nation a lot of depression and pressure. Once more, my sincere condolences go to the family of Dr. Doyin Okukpe. Men, don't be too busy to ignore yourself. Really, nobody cares about you after 60. Learn to care for yourself. I remain Dr. Charles Apoki. I have a webinar coming up on the 14th and on the 15th of March. It's tagged Wisdom to Legitimately Make More Money. Send a message to +234 80 21 21 92 62. And we have real estate for sale. The same number, +234 80 21 21 92 62. God bless you. Remember, this life is a vapor. It vanishes away. Remember, you will only be remembered for what you have done. Learn to leave a good legacy behind. God bless you.